A drug that signals a major step for Alzheimer's treatment has just been approved in Canada. But Alberta research suggests the number of patients it can help could still be limited. So then what makes this approval in Canada so significant?
Well, I think over the last couple of decades, we've seen very little advance in the treatment of Alzheimer's disease. We have tablet medications which can slow progression, but those are targeted at people with established mild to moderate disease. What this does is make people with potentially much earlier disease eligible for treatment.
Now, why is that we don't see a lot in the movement of treatment and supports?
Well, I think Alzheimer's is quite a complicated disease with many ways that might end up with the disease. So expecting a single treatment to have a major impact is probably a little too hopeful. If you think about lifestyle and behavioural treatments and management of other diseases which might lead to impairment in memory, we can potentially avoid about 45% by, if we're all really good and virtuous and follow the precepts of healthy ageing from middle life. Mm-hmm. However, what this drug does is allow us to filter down people with what's called mild memory impairment and find people who might be potentially eligible for this treatment and administer it.
So is that really who it's focused on? Is that mild?
Extremely, yes. So those people with what we call mild cognitive impairment or early dementia thought potentially due to Alzheimer's disease.
Alberta research suggests that the success of it might be limited. Why is that? How does it show us that?
So research by colleagues at the University of Calgary looked at potentially eligible individuals in Alberta and suggested that half of those with mild cognitive impairment might be eligible to go on through the filter mechanism. Other estimates suggest that by the time you go through all of the exclusions and all of the tests, between 6 and 18 out of every 100 people with cognitive impairment might be eligible for the drug. So it's a minority of a wide number.
What are the next steps then to get this actually available so it can start happening for people that they can actually access it?
Well, there is then the provincial approval to make this publicly available. At the moment, potentially with private insurance, it is available. It's approved for use, but then we need to get the structure of our clinics and set up administration clinics, and that's going to take a little while, which will be needed anyway to get this approved.